We're back with another presentation from Maria Victoria Tuya, who's, I understand, is also one of her specialties is a medical translation, right? And her next presentation is about medical translation. So please go ahead.
Thank you very much. Thank you again for this opportunity. Thank you again, Eliezer and Svia. Thank you very much, and thank you all. Okay. I will share. Okay. Well, this presentation is about medical translation, the basic for medical translation. Precisely in this, as it is said in the motto for this conference, for this 2021 conference, the age of uncertainty. So ready, off we go for medical translation. First of all, it would be interesting to see the difference between technical and scientific translation. Technical translation is got to do with more the field of industry and prevails description, while in scientific texts prevails the reasoning. And technical translation, technical scientific translation, or scientific-technical translation has always to be considered as a unit, both in research and in teaching. And this is partly because the boundaries, the limits between science and technology are not always clear. They are object of a study that face from scientific and technological discipline at the same time. For example, if I take any medical text, can be a scientific paper, a scientific report about any experiment being carried out. And it may also a set of instructions for the using for a device. So science refers to the study and observation of the natural world, and with a view to defining strict rules or law. And technology, on the other hand, is the application of set knowledge with a view to manipulating the environment. So it is also a bit difficult to draw to precise boundaries or limits between specialties or between disciplines. There are some authors who did not agree with this. For example, Silvia Gamero and Amparo Hurtado Albir. And they speak about fields and subfields. And they say that the element that best defines this specialized textual discourse is the thematic field. Okay, speaking about specialized translation, we must speak about specialized languages. For example, the ISO 1087 defines a standard, the specialized translation as a language used in the field of knowledge, and it is featured or characterized by the use of specific linguistic means of expression. Okay, there are some other authors, and I won't bore you with theory, that the author themselves do not agree about technical and scientific and where would be medical translation. But we have the specialized translation, and we have technical translation, scientific translation, legal translation, and economic financial translation. There are some authors that include here literary and audiovisual translation, but not all the authors think in the same way. And then we have the proposed international standard nomenclature I brought to the UNESCO and the DCU, and that is a way of structuring and dividing science. All the science has been divided by a proposed nomenclature that is a standard for UNESCO. So you see in the this category, we have computer, I don't know, all about mathematics, physics, etc. And in the category 24, we have life sciences that include healthcare, zoology, chemistry, human biology, etc. The medical science is included in the category 32. We have examples there, and this is the other classification. This is the universal decimal classification with biotechnology, medical sciences, hygiene, all sort of healthcare, pharmacology, clinical medicine, etc. Okay. The difference between scientific and technical derive from the two words that define them. Science as a set of knowledge, observe what I said before, and technique. One is Latin and the other is from Latin and Greek. Well, as I said before, that is not considered as a unit, or maybe considered as a unit, both in research and in teaching. And this is partly because the boundaries are not always clear, according to some authors. Okay, let's assume that we include medicine within the scientific translation, not as a set of procedure, but as research or some experiment. What are the objectives or the characteristics of the scientific text? It is the object of a study of the scientific translation. The informative function of language prevails. It requires from the translator knowledge of the subject, and I will refer to later on because this is very important. And one of the purposes is to clearly and properly communicate the results of a scientific work to a scientific public and public in general. Sorry, there's a typo there. And this is important when we talk later on about the genres, the type of text that we translate in medical text. We are going to see later on why this difference. Okay, which are the characteristics of the scientific text? Language, objectivity, clarity, and formality. Language, because we use a specialized terminology or a lexicon that is specific to each specific area, for example, mathematics, biology, physics, chemistry. Objectivity. There are objective texts, and these texts are based on concrete, verifiable, reproducible data, and they seek to transmit to the reader some aspects of reality approached with a methodological rigor. Subjectivity in this sense is minimized. Clarity. The knowledge to the reader must be communicated in a clear and precise manner, without any ambiguities, and with a clean and orderly syntax. If I am not clear in this point, and if I translate or I confuse milligrams with grams, I will be in a huge problem. So I have to be very clear in this specialized language. And then formality, because the subject is presented and exposed in the formal writing record with objectivity and distance. We must be precise, we must be verifiable, and we must follow a logical order. Okay. Speaking about competences on the technical scientific translator, we have several competences. Some of them are very strict to the work itself, another to the profession. For example, language competitive, the translator, the professional must be skilled, must be proficient in both languages or more than 2 languages, and must understand very clearly the source language and to produce as most clearly in the target language, both written and oral. That will depend on whether the translator or interpreter is involved. Then we have an extra linguistic competence and consists of knowing how to correctly go through the translation process. For example, knowing how to understand the original text and re-express in the target language according to the purpose of the translation. Then we have the professional or the work style competence, and that consists of knowing how to document, and we are going to see that later, knowing how to use the use of new technologies, knowing the labor market, and then we have the strategic competence, that is the procedures that the translator uses to solve the problems that he or she might find in the development of the translation. About knowing the documentation, documentation is important because it acquires knowledge about the thematic field or to achieve skilled or mastery of the terminology specific. Okay. About software skills, any translator must skill or must be proficient in translation memories if the texts are repeated. For example, if a translator always translates letters to the regulatory authorities, for example, FDA or ANMAT in Argentina, and the tenor, the content is very similar, he may use translation memories. If she or he doesn't use a translation memory, which is quite right, may be useful to know how to use a terminology database management. For example, multi-term in SDL Studio. For example, you may use, it is well done if we use the terminology management database and not the translation memory. There are other tools, for example, DTP tools, the desktop publishing, Adobe InDesign, the family of Adobe InDesign, Illustrator, CorelDRAW, etc. This is a must for a translator? Not. This is not a mandatory, but may be useful. If we translate, if we usually translate brochures or manuals, for example, it is useful to how to use these kind of tools. And then we have other tools, the basic, that is the Office software or an OCR software, for example, I slipped from my mind, optical character recognition or software. I can't remember now any brand on the market, but it's useful. Abby Fine Reader, thank you very much. Abby Fine Reader, yes. OmniPage was another brand, just to name a few. Thank you very much. And also to file format management. Do we have to be an expert? No, but this is coming to avoid any time losses. So if we master or are proficient in all these tools, we are going to have more time to translate, to make glossaries, etc. Okay, what is medical translator? We define it that can be a scientific and a technical text, but medical translation itself is a branch of translation that addresses the communication needs of the medical field. It is very broad specialty within scientific-technical translation with unique features that distinguish from other fields. As a specialization translation, it shares many features with other types of translation, but it is very precisely its complexity that make it such a specialty. Fernando Navarro is an author, is a translator and a physician who has been translating medical translation 30 years approximately, and he gives a definition and says that medical translation gives an identity, or is an identity as an independent specialty, and given its complexity, advocates specialized training and exclusive dedication. And I totally agree with him. What are the frequently translated genres or type of documents? For example, in research papers, review articles, clinical trial protocols that are so much involved now with this pandemic situation and the vaccines, case reports, short communications, letters to the editor, scientific editorials, position papers, book reviews, proceedings, and doctoral theses. Within the professional practice, we have clinical guidelines, standard operating procedures of the so-called SOP, summary of products, characteristics, informed consents that are related to the clinical trial protocols, laboratory tests, medical questionnaires, medical terminology glossaries, manuals, maintenance guides, bulletins, expert reports, medical histories. And I forgot to mention the investigative brochures with clinical trial protocols that always are in pairs. As far as the education process, fact sheets for patients, patient information leaflets, course books, training courses, presentations, TV documentary scripts, and that is related, a bit related to audiovisual translator. And about trade, we have drug advertisements, contracts, vial and cartons labels, product information leaflets, catalogs, new drug applications, packaging inserts, patents, and press releases. That is why it is mentioned that medical translation has been increased as a specialization in the last 10 years approximately. Okay, which are the characteristics of the medical text per se? Polymeny, sorry. We have stress, and we may use stress as a mental stress, biochemical stress, torsional stress, and word stress. All these exceptions are different themselves. Then the false friends, for example, disorder or drug. That is not desorden in Spanish, but trastorno. That is a type of the translation. Then neologism nutraceuticals. That is the combination between nutrition and pharmaceuticals. Then we have so-called acronyms and abbreviations. For example, HRT, that is hormone replacement therapy, and CABT, CABT, coronary artery bypass grafting. Quasi-synonymous terms, they have different terms or different shades of the meaning, such, for example, disease, illness, condition, disorder, and sickness. Then we have another characteristic that is very common, the use of separate hyphenated adjective words. For example, enteric coated tables, anemia-related symptoms. Then we have the use of passive voice, that is the opposite as we translate into Spanish, that is a more active voice. The solution was heated to 90 degrees centigrade for approximately 30 minutes and then allowed to cool. And then the eponyms, for example, follow, I can see that, but it's the name of the person who discovered certain disease. Then we have compound nominal phrases as heart failure, patient safety, contrast medium. And the use, a lot of use of Latin and Greek prefixes and affixes, for example, prefix as hyper and hypo, and suffixes like itis, like inflammation. Okay, Which are the sources that we use as translators in healthcare translation or in medicine, medical translation? Terminology sources, glossaries, also both glossaries that we make, that we build, or the glossaries that the client may provide. General and specialized dictionaries, both in paper and electronic. And most linguistic corpora. I don't know if you use also, but I find them a great source. Then we have specialized documents. For example, manuals, books, monographies, research articles, etc. That is also a great source of knowledge. In 10 years ago, approximately, I specialized in traumatology and orthopedics. And I bought several books about bones and grafts and all that, because the glossary and the dictionary was not enough to translate the documents that I was provided. And then we have bibliographic sources such as repertoires, the libraries, both electronic libraries, and websites, all both general and specialized. Then we have online resources such as websites. For example, the WHO, the World Health Organization. There is a lot of information there, not only glossaries, but also papers. Then the PAHO, that is the Pan American Health Organization. Then the renowned FDA use and drug. We have in Argentina the ANMAT, that is the National Administration of Drugs, Food and Technical and Technology. That is the equivalent of the FDA and the EMAA. Then another website, drugs.com, that you may, a kind of Madebecum, that you may see the combination of drugs, all the active ingredients for drugs, and how can be named and all that for the translation. Then this is a very well and very nice website. It's the WebMD for articles and also for definitions. We have an engine there. And then libraries, as I mentioned before, we have the National Library of Medicine. This is a very nice website for articles, for papers, for academic papers, pubmed.gov. Then the NCBI, that is the National Library of Medicine. Then we have another one. This depends on the US government, the National Center for Complementary and Integrative Health. Then we have Medscape. It is all monolingual. I didn't include bilingual with Spanish, but there are a lot of bilingual are in Spanish also. And then we have these papers, this journal of scientific publications, such as New England Journal of Medicine, the JAMA, the Simago Journal and Country Rank, and the Lancet. The Lancet, if I remember correctly, gave a paper about the Sputnik vaccine. That was, for example, at least in Argentina, we were expecting some article from the Lancet. Then we have the Science Direct, a very well-cited website with hundred of academic papers, all with peer review. That is important too. And then we have free medical journals. That is a variety, and I recommend in this website to make a double check just in case. Then we have very well-known academia with academic papers. The sign-in is free on this site. Then we have the MERC manual. For the consumer, we have also the books, and I have a screenshot later on, but this is a free use, a free source for information. It is very good. It is very good. The MERC manual is well known. A website of acronym finder, there is another one in abbreviations.com that is also a very good resource. The books, medical reference books, we have the Bible in medicine, that is the physician desk reference. If there is a person here who translates legal, it is the equivalent of the Black's Law Dictionary. There are all definitions, and it is a beautifully, a very nice desk reference. And then we have authors that Dornans, Stedman, Gray's Anatomy, the Black's Medical Dictionary, a Dornan's Dictionary of Medical Abbreviation and Acronyms, and a Vademecum. I have them all, and they are perfect for translating medicine. We all have a pocket guide or a guide about prescription drugs, that is a Vademecum. And then we have in paper the MERC manual, also for veterinary, if any is specialized in said field. I will put it. The signal seems to be fine. We hope. Then we have a specialized reference of, well, the Dornan Medical Dictionary, and then we have some authors, for example, Janson Cohen, Medical Terminology or Medical Terminology Demystified. It's very good, both of the books. Well, what about training? Training as the medical translator, and is closely related to the motto of this conference, the Age of Uncertainty. We have lived a very difficult year, also in training, but at the same time, it was a very good opportunity to go on training. For example, Coursera, MOOC, Unimog, and EDX offers high-quality courses, translation, not only translation, sorry, but medical training in general, about clinical trial, about pharmacology or basics to pharmacology, a lot of courses, all free. Then it would be ideal to have a university degree in translation and or interpretation, and then to go on for a postgraduate course, a master degree or a PhD degree or a specialized degree in medical translation. There are quite in Europe, in English, Spanish, in German, in French, in Italian, there are several. And then specialized courses, for example, pharmacology, healthcare, general healthcare, anatomy, pathology, etc. But if you don't want to do any of these courses, we may read a lot. There are a lot of books on internet, and we may subscribe to books, for example, to academia or Elsevier. Elsevier is an excellent resource for these publications, and read. If we want to translate medical or to go on medical translation, we may read about pharmacology or general healthcare, etc. And the last sentence, the last text says, we may be an unregistered student at the university. Are we going to get evaluated with this? No, but we are going to get a lot of information. So if, for example, the UBA, the University, la Universidad de Buenos Aires, the University of Buenos Aires, allows that persons that may be an unregistered student and attend several subjects, for example, pharmacology or anatomy. That is a 4-month subject and is perfect. You may register as a unregistered student, and you may take this course. All these are options that we may get benefit from the last year and from this year that I think is not going to be quite different from last year. And that's all. Thank you very much. That's my name. That Eliezer, thank you very much for they gave my name in Hebrew. Thank you very much. This is my email if you want to make any questions or something. I'm in LinkedIn, in Instagram, and in Twitter. Thank you very, very much. Thank you for your attention.